Good afternoon. My name is Doug Lawson. I'd like to thank everyone for being here today. I'd like to thank Jim Parisi and the team at St. Luke's Woodlands for the work that they've done to open the Dan L. Duncan Cancer Center at St. Luke's Woodlands. What an amazing day. The Duncan family and their gift to the Baylor College of Medicine has been truly transformational. The care of cancer patients has been changed, and we are looking forward to seeing the Dan L. Duncan legacy projected into the Woodlands community. What an awesome gift, what an awesome opportunity for our community, but more importantly, the thousands of patients that will benefit from this new center. The Dan L. Duncan Cancer Center is one of only a handful of comprehensive cancer centers across the United States, and only 3 in Texas. Access to innovative clinical trials, the ability to bring cutting-edge research and technologies and treatments to the Woodlands directly is truly an amazing opportunity and critical as we continue to grow St. Luke's Woodlands to meet the needs of this community. So again, we're excited about being here today. I'm sorry that I'm not here in person, but this is a different time, and we're all using technology in different ways. So this virtual ribbon cutting is an important opportunity for us to continue to work despite some of the challenges we're seeing with this virus. But nevertheless, my extreme gratitude to the Duncan family, to the leadership of the Dan L. Duncan Cancer Center in Houston, and the work that they will be doing over the coming years at St. Luke's Woodlands. Thank you all, and congratulations.
Hi, I'm Brad Limke. I'm the Chief Medical Officer for CHI Texas Division. Getting the best care is what we're all after. And comprehensive cancer center like the Dan L. Duncan Cancer Center delivers that care. And to be able to do that close to home, in North Houston, out at the Woodlands, is fantastic. You're able to stay at your house, not have to travel. You can get all of the services that you need at a major quaternary facility at home. To me, it's the perfect marriage of multiple things, of the academics, of the research, and of the clinical excellence. Baylor College of Medicine has one of the largest genomics experts in the world. And that is something that the Cancer Center takes advantage of. Again, all the things that come with an NCI designated cancer center drive clinical trials, multidisciplinary care, clinical expertise, and in a compassionate way. So able to have patient navigators to make the continuum of care that's delivered second to none. We are very focused on the individual, and you can get lost in the giant complexes that are around. And when you have the personal touch of the Dan L. Duncan Cancer Center, I think it's a major advantage. Plus, the connection to the rest of the multi-specialties that are Baylor College of Medicine and CHI, the Woodlands, and CHI Baylor St. Luke's downtown. It really allows oncology to be a strong component within a broader quaternary services. The world is becoming smaller. Our healthcare system's becoming smaller. With COVID, actually, it's taught us how to do telemedicine, telehealth, and that interconnecting the downtown campus with every one of our community hospitals in North Houston, other places. It's the natural progression. It is 2020, we do need to use technology, and we are. And COVID's pushed that forward. The Dan L. Duncan Cancer Center, the planning of this has been going on for a while, well before COVID. But I think we are much more accepting of being able to have those connections as a system. Again, I just want to congratulate all that were involved in this and the hard work that everybody's gone through. Well done, and I am virtually there with you today.
Now we're going to take you on a tour of our new 26,000 square foot facility. The colors and decor in the Dan L. Duncan Comprehensive Cancer Center in the Woodlands were chosen to reflect the same design that the Dan L. Duncan Comprehensive Cancer Center in the Medical Center at the McNair campus has. The Cancer Center is 26,000 square feet of clinic space, patient treatment areas, and other clinical care areas. Welcome to the Radiation Oncology Treatment Center at the Dan L. Duncan Cancer Center at CHI St. Luke's-The Woodlands Hospital. Patients are treated with radiation therapy for a variety of different cancer indications. This is a linear accelerator where patients are treated with radiation. There are multiple modalities of radiation that we can offer our patients with this particular machine. Most patients are treated daily for a prescribed number of days, depending on the type of cancer.
My name is Kent Osborne, and I'm a physician scientist. I'm the director of the Dan L. Duncan Comprehensive Cancer Center at Baylor College of Medicine in Houston. And one of the things that we always wanted to do was to have a network of affiliates that were affiliated with us so that we could offer our expertise to people in more rural communities. Texas is a big state, and so that we could develop partnerships with the physicians in those areas. When Catholic Health Initiatives bought several hospitals in this area in southeast Texas, and when Baylor became a member of one of those hospitals, became a part owner of it, we thought that was an opportune time to begin developing a network. So the first one was the Woodlands. It's now ready to go and we're very happy about it. And the intent is, the eventual goal, part of our strategic plan, is to develop more of these networks, network hospitals, even further out in the community. And hopefully one of these days we'll have 3 or 4 or 5 of them.
I'm Muller Ma, I'm professor and executive medical director of the Dan L. Duncan Comprehensive Cancer Center. So as you know, the Dan L. Duncan Comprehensive Cancer Center is an NCI designated comprehensive cancer center. And part of that comprehensive designation is the depth and breadth of the research that's ongoing in the cancer center, but also its attachment to the catchment area or the area that we serve, our community. So it's been always part of the vision for the Cancer Center to expand its services out from the medical center to where patients are across our region. Of course, through the partnership with the St. Luke's Health System, it became very natural for the Cancer Center to extend out into the other sites across the Texas division. The Woodlands Hospital, St. Luke's Woodlands, was the natural first step. It is in a heavily populated suburb of Houston. It is in an area where our health system, St. Luke's, and other health systems have been paying a lot of attention. And so we thought that that would be a natural extension. And that journey has kind of taken a few years. It started off by one of our faculty who was working here, Dr. Angie Cosio, essentially moving up to start and lead the practice over at the Woodlands. And then working through leadership in the division and the different components of the health system and the cancer center leadership, we developed specific criteria for clinical care, but also focus on the academic missions of research and education to extend the cancer center name and quality service to the Woodlands. And working closely with the leadership of St. Luke's Woodlands and the division leadership, Dr. Limke and others, Jim Parisi, we were able to start the process. And then right before the pandemic started, there was an official approval of the membership of the St. Luke's Woodlands as an official site for the Dan L. Duncan Comprehensive Cancer Center. The state of Texas has only 3 comprehensive cancer centers, 4 total and 3 of them comprehensive. And the NCI designation says that the National Cancer Institute of the United States gave us special recognition that we are carrying out the missions of cancer research, cancer education, and cancer care at a high quality level. that meets their criteria. The comprehensive designation is kind of the elite status of NCI designation. It means more expanded research, more depth and breadth, and specifically in the area of population health and population sciences, meaning how are you making an impact for the general public, for all cancer patients across the region you're serving. And then, so being one of 3 only in the second most populous state in the Union is, of course, telling you how competitive and how high of an acknowledgement and an honor it is to have it. I think what's really wonderful about our cancer center is that it's really the partnership of an NCI designated comprehensive cancer center in a top 20 medical school, in the best in the state of Texas, as with a very comprehensive and highly respected health system. The 3 of them coming together is so unique because it really offers all the strengths of all the 3 components to yield or result in the wonderful care that we hope to provide our patients with. And I think this is something that's unique.
My name is Cosio, and I am the Regional Medical Director for Oncology at CHI St. Luke's-The Woodlands Hospital. Baylor College of Medicine and the Dan Duncan Cancer Center in Houston has been an excellent cancer center in our community and is now wanting to offer services here. So we're now able to offer the clinical care that patients would receive at Dan Duncan for medical oncology, for radiation oncology, and are working with other partnerships to offer other aspects of the same cancer care here. With that partnership, that allows us access to some of the clinical trials and research and expertise that's available in the medical center location of the Dan Duncan Cancer Center as well. When we're treating cancer here at St. Luke's Hospital in the Woodlands, we have access to so many resources here at our hospital in this community as well as at Baylor. Main cancers that we treat are the more common ones: breast cancer, lung cancer, colon cancer, prostate cancer, but we really treat every cancer. When it comes to breast cancer, we have a amazing women's imaging center, and we work in very close partnership with them. So the radiologists, the medical oncologists, surgeons, radiation oncologists work together in real time in tumor boards and in other types of communication to make sure that we're taking care of our patients. When everything's under one roof, it does a couple things. It makes it so much easier for the patient. They don't have multiple stops. They learn their way around the hospital. They learn their way from the parking lot to the cafeteria to the appointments. They can coordinate appointments. They don't miss as much work. Their family members are able to do the same. But also, when we're all under the same roof, that means all of their doctors are under the same roof, and we know each other, we speak to each other regularly. We're not faxing records back and forth, we're actually talking. We're looking at somebody's mammogram or CT scan together and making a plan as a team. One thing I think that's special about the technology is that in addition to having the top tier radiology department, women's imaging department, we also have a PET scan within our cancer center. So we really have every imaging modality that we need for our patients here in our hospital. The second floor is where medical oncology clinic patients are seen, as well as chemotherapy infusions are administered. Our lobby is decorated with art from a local artist. Chemotherapy is administered in this part of our clinic. We have multiple different types of infusion rooms. We have the ability to treat patients who have longer infusions in private rooms with a bed for their comfort. We also have private infusion rooms with recliners and chairs. We have one infusion area with multiple chairs for patients who have either fast infusions or would be more comfortable being closer to other people.
My name is Heather Lazada, and I am the Education Specialist for the Family Birthing Center here at St. Luke's. 6 years ago, this month, really, I was diagnosed with stage 4 breast cancer initially. I was in the process of moving from Lubbock to the Woodlands for a position actually with St. Luke's. And upon my moving, it was actually my last day of work at my previous job. I had noticed a lump and I called my OBGYN. Had an ultrasound that day, and a few minutes later I had a mammogram because the radiologist was like, you need a mammogram. And then a few days later I was told that I had breast cancer. And on my way down, I was actually in the car, I received a phone call of saying that it was actually stage 4. And my breast cancer had metastasized to my liver and my lungs, and then also my bones. And then coming to Houston, I really didn't know what to do, didn't know where to start. And I had a really good friend that actually worked with, she's a physician with Baylor College of Medicine, and referred me to Dr. Osborne. And he's been such a lifesaver. I really felt like a person with Baylor, not just a number. And after my first visit, probably about 10 days later, is when I started chemo. I just had my, I think, 105th infusion last week. I get chemo infusions every 3 weeks. And for the past year and a half, I've been able to actually receive it out here in the Woodlands, which has been such a blessing, because going downtown, though it's fun and I love seeing my nurses down there, it's also it takes a big chunk out of my day. And I have 2 kids. I have they are now 6 and 8. Initially they were 10 months and almost 3 when I was diagnosed. So now I really am able to spend more time with them. My infusions don't take as long. I can quickly come in, get my infusion, and go home and be where I'm supposed to be. I've really enjoyed getting treatment out here. I definitely feel very cared for. Everyone knows my name. When I come in, they call me by my name. I have a specific chair. They know where to know where to put me. But I know that I'm getting the best treatment. I know that the treatment that I'm receiving is evidence-based and it's researched. I know that the staff here are good employees, and they do truly care for people, and not just because I work here, but they care for the patients that come into this building. It's been very nice to have everything that I need right here in this building. If I need an MRI, it's just downstairs. If I need blood work, it's just downstairs. And it's nice to know where people know who I am, and so it's more family-like, and it's very caring.